হ্যালো ফিউচার নার্সেস, ওয়েলকাম ব্যাক টু মাই চ্যানেল। আজকের প্রথম কোশ্চেন হচ্ছে, হুইচ প্যারামিটার ইজ দ্য মোস্ট রিলায়েবল ইন্ডিকেটর অফ শর্ট টার্ম ফিজিক্যাল গ্রোথ অ্যান্ড নিউট্রিশনাল স্ট্যাটাস ইন ইনফ্যান্ট? হেড সারকামফারেন্স, বডি ওয়েট, ক্রাউন হিল লেন্থ, চেস্ট সারকামফারেন্স। অ্যান্সার: body weight. Weight is the most sensitive and rapid indicator of acute nutritional fluctuations and overall health status in infants. Second question, at what age does a normal infant usually double their birth weight? 3 months, 5 months, 9 months, 12 months. Answer: 5 months. Birth weight typically doubles by 5 to 6 months of age and triples by 12 months of age. Question 3. According to Erickson's psychosocial theory, the developmental crisis of a toddler is trust versus mistrust, initiative versus guilt, autonomy versus shame and doubt, industry versus inferiority. Answer: autonomy versus shame and doubt. Toddlers strive for independence in control over bodily functions and choices. Strict limits or harsh judgment lead to shame and doubt. Question 4. Posterior fontanelle normally closes by which age? 6 to 8 weeks, 3 to 6 months, 12 to 18 months, 24 months. Answer: 6 to 8 weeks. The triangular posterior fontanelle closes yearly, usually by 2 months of age, whereas the larger diamond-shaped anterior fontanelle closes between 12 and 18 months. Question 5. A child is expected to achieve independent, unassisted walking without support at approximately what age? 9 months, 12 months, 15 months, 18 months. Answer: 12 months. Most toddlers take their first independent steps around 12 months, range 9 to 15 months. Question 6. The permanent reflex that persists throughout a person's lifetime from infancy is the Moro reflex, rooting reflex, sucking reflex, swallow reflex. Answer: swallow reflex. Protective reflex like swallowing, gagging, blinking, and sneezing remain for life, whereas primitive reflexes Moro, rooting, tonic, neck disappears during infancy. Question 7. Play type characteristics of toddlers where they play side by side with similar toys without interacting actively is called onlooker play, solitary play, parallel play, associative play. Answer: parallel play. Parallel play is typical of toddlers. Preschoolers engage in associate cooperative play while infants practice solitary play. Question 8. The average head circumference of a full-term newborn at birth of is approximately 25 to 30 cm, 33 to 35 centimeter, 38 to 40 centimeter, 42 to 45 centimeter. Answer: 33 to 35 centimeter. Normal newborn head circumference ranges between 33 to 35 centimeter, roughly matching chest circumference at birth. Question 9. Freud's psychosexual stage corresponding to the toddler period is the oral stage, anal stage, phallic stage, and latency stage. Answer: anal stage. Focus shifts to control of body waste and toilet training during the anal phase. Question 10. The normal range of heart rate for a resting full-term newborn is 80 to 100, 100 to 120, 120 to 160, 140 to 180. Answer: 120 to 160. Newborn heart rates fluctuate, can drop to 100 when sleeping and rise to 180 when crying, but the standard baseline is 120 to 160. Question 11. The preferred site for obtaining a capillary blood sample heel stick in a newborn is center of the heel, lateral or medial plantar surface of the heel, great toe, The posterior curvature of the heel. Answer: lateral or medial plantar surface of the heel. Puncturing the central heel risks damaging underlying calcaneus bone, nerves and cartilage. Lateral medial borders must be used. Question 12. What is the primary purpose of administering vitamin K intramuscularly to a newborn shortly after birth? Prevent hyperbilirubinemia, stimulate active immunity against hepatitis, prevent hemorrhagic disease of the newborn, enhance digestion of breast milk protein. Answer: prevent hemorrhagic disease of the newborn. Newborn guards are sterile and lack intestinal flora needed to synthesize clotting factors 2, 7, 9 and 10. Vitamin K injection prevents dangerous bleeding. Question 13. A newborn with excessive drooling, choking and cyanosis during the first initial feed likely has congenital diaphragmatic hernia, pyloric stenosis, esophageal atresia with tracheoesophageal fistula, Hirschsprung's disease. Answer: esophageal atresia with tracheoesophageal fistula. The 3Cs, coughing, choking, cyanosis during initial feeding strongly indicate an upper GI tract malformation like esophageal atresia with esophageal fistula. Question 14. Phototherapy is primarily used in neonates to treat hyperbilirubinemia by converting bilirubin into biliverdin through oxidation. Water-soluble isomers excreted via bile and urine, fat-soluble compounds stored in subcutaneous adipose tissue, conjugated direct bilirubin inside hepatocytes. Answer: water-soluble isomers excreted via bile and urine. Phototherapy induces photooxidation and structural isomerization, transforming insoluble unconjugated bilirubin into water-soluble forms that require no hepatic conjugation for excretion. 15. Apgar scoring assesses 5 parameters at 1 and 5 minutes after birth. Which of the following is not part of the Apgar score? Heart rate, respiratory effort, blood pressure, muscle tone. Answer: blood pressure. The 5 components of Apgar are appearance, color, pulse, heart rate, grimace, reflex, activity, muscle tone and respiration. 16. Kangaroo mother care provides which of the following primary benefits for a low birth weight infant? Rapid artificial weight gain by hypercaloric formula, thermal regulation, bonding and stabilization of vital sign, total prevention of neonatal sepsis, elimination of the need for routine immunization. Answer: thermal regulation, bonding and stabilization of vital signs. KMC utilizes skin to skin contact, maintaining stable body temperature, heart rate and promoting successful breastfeeding. Question 17. The gold standard diagnostic confirmation test for Hirschsprung's disease congenital aganglionic megacolon is barium enema, rectal suction biopsy, abdominal ultrasound, anorectal manometry. Answer: rectal suction biopsy. Biopsy proves the absence of ganglion cells in the submucosal and mesenteric plexuses of the distal colon. Question 18. Meconium aspiration syndrome most commonly occurs in which type of newborn? Extreme preterm infant, post-term infant, appropriate for gestational age term infant, infant of a gestational diabetes mother. Answer: post-term infant. Post-term pregnancies more than 42 weeks undergo increased fetal stress, triggering hypoxic gut motility, relaxation and passage of meconium into amniotic fluid, which is then aspirated. Question 19. Cephalohematoma differs from caput succerinum because crosses Schweitzer lines, does not cross Schweitzer lines and is bounded by bone periosteum, consists of diffuse subcutaneous scalp edema, disappears within 24 to 48 hours spontaneously. Answer: does not cross suture lines and is bounded by bone periosteum. Caput crosses cranial suture lines. Serosanguineous fluid cephalohematoma is subperiosteal hemorrhage and strictly respects suture boundaries. Question 20. The initial fluid of choice for resuscitation of a child presenting with severe hypovolemic shock is 5% dextrose in water, isotonic crystalloid solution, packed red blood cells, hypotonic maintenance fluid. Answer: isotonic crystalloid solution. Example: normal saline or Ringer lactates at 20 ml per kg. Isotonic boluses expand the intravascular extracellular compartment rapidly without pulling fluid intracellularly. Question 21. Exclusive breastfeeding is recommended by the World Health Organization up to what age of the infant? 4 months, 6 months, 9 months, 12 months. Answer: 6 months. Breast milk alone provides all essential nutrients and water for the first 6 months of life, after which complementary foods should be added. Question 22. Celiac disease requires the permanent dietary elimination of which protein substance? Lactose, gluten, casein, fructose. Answer: gluten, found in wheat, barley, rye. Celiac disease is an immune-mediated enteropathy triggered by ingestion of gluten, leading to villous atrophy in the small intestine. Question 23. Vitamin A supplementation is distributed globally to young children primarily to prevent rickets, xerophthalmia and reduce measles, neural tube closure defect, iron deficiency anemia. Answer: xerophthalmia and reduce measles, diarrhea mortality. High dose vitamin A campaigns protect ocular health and drastically lower childhood mortality from infectious complications. 24. Kwashiorkor is a form of severe protein energy malnutrition distinguished clinically from marasmus by the presence of severe muscle wasting and absence of subcutaneous fat, generalized pitting edema, moon face and fatty liver infiltration, extreme hyperactivity and ravenous appetite, normal serum albumin levels and stunted height. Generalized pitting edema, moon face and fatty liver infiltration. Kwashiorkor result from severe protein deficiency despite adequate caloric intake, leading to hypoalbuminemia and third space fluid accumulation. 25. The single leading infectious causes of death in children under 5 years globally is measles, pneumonia, tuberculosis, pertussis. Answer: pneumonia. Acute lower respiratory infections, primarily bacterial or viral pneumonia, account for the highest mortality among young children worldwide. Question 26. The organism responsible for whooping cough is Corynebacterium diphtheria, Bordetella pertussis, Mycobacterium tuberculosis, Clostridium tetani. Answer: Bordetella pertussis. Pertussis is a highly contagious respiratory infection characterized by paroxysm of coughing ending in a characteristic whoof sound during inspiration. The most common primary malignant brain tumor in children is glioblastoma multiforme, medulloblastoma, neuroblastoma, retinoblastoma. Answer: medulloblastoma, cerebellar astrocytoma. In infratentorial tumors like medulloblastomas and cerebellar astrocytomas are the most frequent pediatric central nervous system malignancies. Question 28. Signs of increased intracranial pressure in an infant include sunken fontanelle and constricted pupils, bulging fontanelle, separated cranial suture and high-pitched shrill cry, hypotension and rapid weight loss, hyperactive deep tendon reflexes with sunken eyeballs. Answer: bulging fontanelle, separated cranial suture and high-pitched shrill cry. Infant possess detachable cranial suture, so rising ICP presents with skull expansion, tense, bulging fontanelles, irritability, and projectile vomiting. Question 29. Coplic spots, small white spots with a bluish white ring on a red background appearing on the buccal mucosa are a diagnostic pathognomic sign of rubella, rubeola, varicella, scarlet fever. Answer: rubeola, measles. Coplic spots appear 2 to 3 days before the classic maculopapular rash of measles, serving as an early diagnostic markers. Question 30. At which age social smile appears? 1 month, 2 months, 4 months, 6 months. Answer: 2 months. A social smile is an important developmental milestone where an infant responds directly to a human face or voices, typically emerging around 6 to 8 weeks, 2 months of age. Thank you for watching and subscribe Nurse Profession Bangla.